we're here, Atlas Answers today with John Bridges, and talking a little bit about one of the patients that we had come in, having a lot of questions this morning about how do they know or when should they be checked for diabetes. I think a lot of times, like when you have these folks who come in, right, and they don't know, should they come, should they not come?
Right.
And I think that sometimes makes it difficult for patients to know
Right.
when I should call and get an appointment, right?
Yeah.
But how do they know? What are some of the things that patients are commonly coming and complaining of, going,
Right.
I think this might mean I have diabetes,
Right.
versus what are the things that actually we need to be looking for that say, hey, maybe we should check for diabetes?
That's a good question. A lot of times, a lot of these symptoms are very minor in the beginning, so they go dismissed. One of the most common one is increased urination. People may write it off to if they've been drinking more fluids, or they've getting older and getting up during the night more. They write it off to certain other things.
I was going to say, you and I are kind of getting to this age where
that's right. I get right, exactly.
Every morning
getting up
I
a lot more.
be asking myself, should I be checked for diabetes?
Yeah, well, yeah. Well, I do get up a lot during the night, and I have been checked for diabetes. And my situation is not diabetes, but and then of course with the increased urination, it leads to things like increased excessive thirst. Because they're excreting more urine, so they trigger that thirst mechanism a lot more. Increased hunger, cells don't get the sugar they need, so they feel more hungry, and they wonder why they're eating more and gaining weight for no reason or something, and it's high blood sugar levels. Some women get a lot of yeast infections.
A lot of times that goes right along with when somebody's having to urinate a lot and they have high blood sugar in their urine. It'll a lot of times lead to urinary tract infections and yeast infections that maybe they weren't having before.
Right.
Kind of an unusual thing.
Other things could be like delayed healing. Well, they may get a cut or something, and why ain't this healing like it should? Why is it taking so long? Well, high glucose, high sugar levels, mess with your circulatory system, and you just don't have the blood supply like you used to in smaller areas. So minor cuts may take longer than normal.
Especially those really small blood vessels. When we think about the sugar levels, how it affects that circulation in the small blood vessels, and really not just acutely, even though it does happen if your blood sugars are high, right? With surgeries, we will postpone surgeries to get people's blood sugar down because they won't heal as well. But also, over the course of time, over the course of years, that circulation of those really small blood vessels can really just be problematic. Also you hear people, they may have blurred vision because high glucose sugar levels can also cause the lenses in your eyes to flatten sometimes, and they may just think they're needing glasses or something like that, and the sugar's high. Yeah, I've even had it where when people come in and we bring their sugar, they didn't know they were diabetic.
Right.
We bring their sugar down. They're like, Doc, my eyesight got worse.
Right.
And in the same reason that people get thirsty, right? Not only are they just urinating a lot, but when that blood sugar level is so high, our body knows that, I hate to say it's concentrated, but it's very concentrated, right? If our sodium level is really high, if our blood sugar is really high, our body knows we need to dilute that, right? And this thirst mechanism kicks in and says we need water. And so a lot of times they're drinking a ton of water, trying to bring that solute level down.
Right.
And the same thing happens in that lens. It swells up, and then we bring somebody's blood sugar down. I always tell them, don't go get glasses until we fix your
sugar problem,
because we don't know. I've seen people get glasses, and then 3 weeks, 4 weeks later, they go, I've got the wrong prescription.
Right.
Because their lens has changed.
Right. Yeah, that's it's funny how much sugar can affect the body. You just don't think about these different things, and there's so many other things that people can equate to. I feel I'm thirsty because it's summertime. I'm dehydrated. I'm drinking more coffee. No, and it could be as simple as just they're starting to get diabetes. And
I think a lot of times as well, sometimes people feel a little bit embarrassed because they maybe somebody says something like, oh, well, my cousin had this and it turned out to be diabetes. And then they become a little embarrassed because they go, I've had these symptoms, but I didn't notice them.
Notice them, right.
And they don't want to go get checked. How do you help tell a patient, right, or a friend who says, I'm not sure if I want to go get checked? How do you help walk them through that?
Well, I mean, it's something that, like you said, it starts off slow, so it's a slow process, and the earlier you can get detected for diabetes, the better the long-term plan is, and it's better for you in the long term because diabetes causes a lot of damage to your, eyes, kidneys. And the earlier you can get tested and find out that you are diabetic, the easier it is to manage it early on than late.
Yeah, a lot of times people think, I'm going to come in, I'm going to get insulin.
Right, exactly. And it's not. It could be as simple as a changing a diet. You're certainly starting off with diet and exercise in the beginning, losing some weight, which, everybody needs to do. I know I don't look like I do, but I do.
That's funny too.
and exercise, and then if some people may need a little more, and there's there's tons of medications that can help with this now. And there's some medications now that help with sugar and weight loss. So there's a lot of different things you can do early on to get it under control, so you don't have that problem later down the road with people
with those
circulation and losing toes, and
especially as we get older.
As we get older, it's harder to control
toes.
Exactly. So
I even think I have a friend from medical school, fantastic doctor, like just wonderful fella, super smart guy, wonderful dad, and when his child was diagnosed with diabetes, she got hospitalized, and all of a sudden he's like, I realized these symptoms have been going on for weeks, right? And as a doctor, I didn't put them all together, right, until one day I did, and it was like I could see it all. And I think for patients that's a lot of times hard because they've not gone to medical school, right? Yeah, they're not supposed to, right? That's what we're supposed to be doing is to help. And sometimes there's almost this sense of embarrassment that, oh, I didn't see this or I didn't know this, and yet it's easy to get checked, right? And it's so gradual, it's easy to think that way and not really, because any one of these things, kind of like we were joking early, doesn't mean that you have diabetes, right? It could just mean that you have yeast infections, and, or that we're getting older, and we're getting older, and we have to go to the bathroom at night, right? That's just something that's common, and so it's really hard to know sometimes if you have one thing, or if you have two of these, or if you have three of these. Do I have diabetes or do I not? And really, the only way for us to diagnose diabetes is through blood work, right? Like, I mean, you have to, we have to check to see what your sugar level is. There's a couple different ways that we can do that. Right. We can check their fasting blood sugar. We could do a glucose tolerance test, which we rarely do anymore. I mean, we still do it for gestational diabetes, but that's not kind of our wheelhouse. Or we check an A1C as well.
That would be the easiest,
Yeah, and that kind of gives us that 3-month window to say, this is kind of what the average blood sugar has been. But really, without that blood work, it's hard to know, if you have diabetes or if you don't have diabetes, right? These symptoms may point towards, but are never diagnostic of diabetes. And I think that, if I was trying to tell my friends or my patients, what to do is, if you're seeing these things, it's an easy blood test. Right. So it's a really easy blood test to go and have done to check and see. Most people are getting at least a screening for it once a year, right? Like most people, if they're getting their annual blood work, that blood sugar is being included in that. Right, and they're fasting, so they're getting a true fasting sugar. Though it is important to note that A1Cs, right, are not part of that annual wellness visit, right? Because insurance companies still do not recognize that as a screening tool, and so we're using the fasting sugar. And so, if in between, right, your annual wellness visits, something's happening, a lot of times we'll use the A1C not as a screening tool, but as a diagnostic tool,
exactly.
Which is really good as a diagnostic tool, but it's not yet recognized as screening, so we can't do that on people's annual blood work.
But it will certainly give us a reason to if they're fasting and their sugar comes back.
Yep. Or even if they come back with any of these symptoms, right? Then that becomes a reason for us to ask the insurance company to go ahead and pay for this A1C, because it's not screening anymore, but it's diagnostic.
Exactly. So,
and I think trying to remove that fear from patients is always one of the things that I've tried to do in talking to my friends and things like, I don't want to have diabetes. Well, nobody does.
Nobody does, right?
But if we can catch it early, then it's a lot easier to not have to go to all these other medications and just do diet modifications, some weight loss, some lifestyle modifications, which long term is going to be far healthier than having to take medication.
Oh, definitely.
Anyway.
Yep. And of course, when you start doing the diet and the exercise, then you start, benefits of blood pressure and your joints, and a lot of good things come with just having to change your diet. And sometimes that can just be the kick in the pants people need. The fear of getting, diabetes full blown, and be the kick in the pants they need to start doing better and making healthier choices. Because certainly as we get older, it's everything slows down, and
nothing is as easy as it used to be.
No,
right?
They always say getting older is not for wimps, and
that's
I believe that.
Well, true. There's only one alternative, though, that we found, and we're trying to avoid that.
Exactly, yeah. It's always better to be seen than viewed.
That's right. That's so true. Well, let's go see some patients. I think that makes a lot of sense.
All right, good. Thank you.